All right, so I am Megan Moran. I'm the resource sharing librarian here at the Oakland Public Library. Thank you all for being with us tonight. And I'm going to introduce our presenter tonight, Sue Latosha, who's in community outreach at Advocate Christ Medical Center. Sue has done and partnered with the library to do a lot of programs, so we're really fortunate tonight to be able to hear from her a little bit more. And this is her kind of talk on skin cancer. And we are having this talk this month to kind of lead into a program we're having next month, which is a skin cancer screening, which is going to be here at the Oakland Library on Saturday, September 25th from 9 a.m. to 12:30 p.m. And if you wanted to participate in that, we do ask that you email Sue to get a spot and make an appointment. But that's a really great thing that we're going to be doing, and it's going to be held here at the library. So I'm excited about that. And I'm going to let Sue take it away now.
All right. Thank you, Megan, for this opportunity of presenting this very important topic on skin cancer. And we will be learning many different things tonight in regards to skin cancer. First of all, we are going to be learning how common is skin cancer, what is skin cancer, and the different types of skin cancer. As many of us know, there's melanoma, squamous cell, basal cell. So what makes up the difference between those? The causes of skin cancer and the risk factors. We want to make sure that you know how you can prevent it, what you can do, and more information along the way. So first of all, how common is it? Skin cancer is actually the most common of all types of cancer. It affects 1 in 5 Americans, and by the age of 70. And then more than 2 people die of skin cancer in the United States every hour. So by the time this presentation is over, 2 people will have been fallen from melanoma. And the sad thing about it is that melanoma is the deadliest form of cancer, but it is the most preventable if caught early and the most curable if caught early. So that's why we are providing these presentations all over the city. So if any of you on the call tonight are interested in having any of your groups or churches or organizations learn more about skin cancer, by all means, let us know, and we will make sure this happens. We actually work in collaboration with a foundation called March for Meg. And you'll find out a little bit about more of that at the end, but it was started by Meg Moonan's family. And Meg is the person who passed away from melanoma. She was a young mom. So her family started this foundation so that it doesn't happen to anyone else. So I would like all of you to learn from tonight and pass this on to other people so that other people are aware of how to prevent this very deadly disease. So now that we've gone through that, cases of melanoma have been increasing for many years. It is the most common cancer in the United States and worldwide, and there could be many reasons for that. Tanning beds could be a reason. We are out in the sun more. We aren't wearing as much clothing as we used to, but the fact remains is that skin cancer is on the rise, so we need to be more aware of it. Having 5 or more sunburns doubles your risk of melanoma. And by the way, 1 visit to a tanning bed increases your chance of melanoma by 75%. That's amazing. So anybody you know who goes to tanning beds, please tell them do not do that anymore. If you have any children or grandchildren who want to go to tanning beds for prom, homecoming, whatever, please discourage them. 1 time in a tanning bed increases, repeat that, your chance of melanoma by 75%. So when detected early, the 5-year survival rate for melanoma is 99%, which is phenomenal. What is skin cancer? It's basically an abnormal change in skin resulting from uncontrolled cellular growth. So here is a picture of your skin, you've got the epidermis, which is the top layer, the dermis, which is the middle layer, and the subcutaneous, which is the bottom layer. And the skin is a very important organ in our body. It is actually the largest organ in our body. In fact, I just played a game this week and they asked me what the largest organ was, and I knew it. So I was proud. So all of you know that this is an organ. It is the largest organ of your body. It does prevent water loss. It has a lot of good causes for it. It shields the internal organs in the event of injury. It regulates body temperature. It senses outside stimulus, such as touch, as well as heat and cold. So it protects us from outside danger. And it serves as a barrier to infection. So if your skin has a cut in it, you are much more likely to develop an infection. So that is the reason we cover any lacerations or open areas with a Band-Aid. And then you can leave it open at night when you're not working around bacterial-laden surfaces. So, because air does help your skin to heal also. Skin cancers are named for the type of cells that become cancer. So with melanoma, cancers that develop from melanocytes, the pigment-making cells of the skin, are called melanoma. So melanoma comes from the melanin cells of your skin, and the melanin cells of your skin are what causes the color in your skin. So the more melanin you have, the darker skin you're going to have. There are other skin cancers, basal cell carcinoma and squamous cell carcinoma. Those are non-melanoma skin cancers because they tend to act very differently from melanoma. So these are the two most common forms of skin cancer, basal cell and squamous. So here's a little bit about melanoma. There's 4 types of melanoma. There's a superficial spreading, and this is a picture of it, how it will look over time. It typically begins as a little dark spot, like those little black spots you see in the middle. And it is asymmetric, has irregular borders. So it's not just a circle, it's very irregular. And it has changes of color. Then there's a nodular form. So it's going to be up, elevated from your skin, like a little elevated mole. But it starts as a raised spot, dark or light, and grows up. So if something like that starts to happen, you need to definitely let your doctor know. And then there's lentigo maligna. And it starts as an irregularly shaped tan or brown spot, which we have often. It grows slowly over years, and then it can become raised or change colors. So when it becomes raised or change colors, that's when you need to notify your physician. And you should be seeing your physician every year for skin cancer checks. And this acral lentiginous is actually something more common in your darker skin toned people. You will often see this in the nail beds, on the palms of your hands, in between your fingers. I'm not sure what you see here, but in between your fingers, or in between your toes or the bottom of your toes. So this is something very important to look at. And just to let you know, we do have interns who are working with the March for Meg Foundation. And one of the girls obviously was learning about melanoma because of this foundation and teaching it to other people. And she knew about this acral lentiginous. And she was in a boat one day with one of her family friends and just happened to see his toe with this long, dark line on his big toe. And she said, "Have you had that checked out?" And he never did. And she said, "You need to go to the doctor and get that checked out." So she saved his life because it was melanoma and he was able to get it treated. So as I'm saying this to you, please heed what we have to tell you and make sure you look at other people and let them know, because people who aren't aware of the signs are definitely at a disadvantage. So we are wanting all of you to be heroes for melanoma. Melanoma is a cancer that starts in skin cells called melanocytes that we had discussed just a slide earlier. And it's estimated that the number of new melanoma cases diagnosed in 2021 will increase by 5.8%. And again, there's many reasons for that. The number of melanoma deaths is expected to increase by 4.8%. So our goal is to decrease this 4.8% just by letting people know that it's out there. Keep an eye on it and get to the doctor early. Most melanomas are caused by the sun. One United Kingdom study found that 86% of melanomas can be attributed to exposure to UV radiation from the sun. And there's different kinds of radiation, UVA and UVB, which we will also go over. Melanoma accounts for 6% of new cancer cases in men and 5% of new cancer cases in women. So men are a little bit higher, most likely because men are a little bit more hesitant to wear sunscreen. I know I literally have to sneak up on my husband to put sunscreen on him because he just doesn't want to wear it. So definitely, I think, George, are you on the line? I think I saw your name. I hope you're using sunscreen out there. And women, keep using that sunscreen. So melanomas can grow anywhere on the skin, but are more likely to start in certain locations. The trunk of men, and I do know someone, and if it's on, so the trunk is the front and the back. And when it's in the back, it's very easily missed. So that is why you have to have other people check the parts of your body that you can't see. And they need to keep you aware of what's going on. And another reason why you should be checking in with your physician on a yearly basis, because they do a mapping of your skin and any unusual markings. It also occurs on the neck, legs, and face. Mostly men get it on their trunk and women get it on their legs. So here's the stages of melanoma. Stage 0. Stage 2 gets a little deeper. Stage 1, I'm sorry. Stage 2, stage 3, and stage 4. So this is the way it starts out. This is when we want to catch it. By the time it gets to this stage, it's very difficult to treat. So that's why you are here today, and we want you to spread the word. So as soon as you see something unusual, we want you to call your physician. An easy way to distinguish if something is time to call a physician also, if you've been monitoring something and you're not quite sure if you should call your physician about it, if it's bigger than the size of a pencil eraser on the tip of your pencil, then it's time to definitely call somebody, and they should either do a biopsy or look at it to make sure that it's okay. But definitely call somebody before it gets too late. The survival rate falls to 66% when the disease reaches the lymph nodes and 27% when the disease metastasizes to distant organs. So this is a cancer. It does spread to other organs and it does metastasize. So it's not just a little skin flap. It's not just a little mole. It is a very dangerous cancer and should be treated that way. So again, melanoma is one form of skin cancer. It is the deadliest, but most preventable, but most curable if caught early. Basal cell carcinoma is not the deadliest, but it is the most common. So again, this affects the epidermis, and the basal cells come from underneath the epidermis. Under the microscope, these cancer cells look a lot like the basal cells of the epidermis. And they usually develop because in some exposed areas, especially the head and neck. So the more you are in the sun, And it usually is something where these basal cell is something that really develops from childhood all the way to adulthood. So it's from many times it's from repeated sunburns early in childhood. And the cancer cells just continue to proliferate and start causing that basal cell carcinoma. Once found only in middle-aged or older people, they now are also being seen in younger people. And again, there's many reasons for that. They're slow growing. So again, we tend to have our children, our infants out in the sun earlier than people did in the past. I think because we're outside more. This rarely spreads or metastasizes, so it's not as deadly, but it definitely is still something that can grow into a large carcinoma that needs to be removed. And if not treated, it can invade other areas of the bone or other tissues beneath the skin. After treatment, basal cell carcinoma can recur or come back in the same place on the skin, but you definitely want to have it treated. And basal cell is something you find more, it's very common on the face, and many times you'll have um, it's not an abrasion, but it's like a little mark that, a little area that tends to bleed, and it never really heals. And that's the key to a basal cell, is that it never goes away. And this is what it tends to look like, just a little sore like that. And then over time, it can develop to something like this. Again, something like this, turn into that. So this little things like this, you might think, oh, it's just, something that's going to go away, but it doesn't go away unless it's treated. And like we said, it may come back, but you still need to treat it each time it comes back. Squamous cell is the second most common. It's estimated that 1.8 million cases of squamous cell carcinoma, that's SCC, are diagnosed in the United States each year. They commonly appear again on sun-exposed areas of the body, face, ears, neck, lip, and back of the hands. They can also develop in scars, chronic skin sores. So if you have psoriasis or some skin irritated area that is always there and always scratching, itching, always being exposed and open, an open wound that just doesn't heal, a lot of times squamous cell will invade that area. It tends to be much more aggressive than the basal cell cancers. It's more likely to invade fatty tissues just beneath the skin and are more likely to spread to the lymph nodes. And again, once it gets to the lymph nodes, it definitely causes a lot more issues. And this is what a squamous cell looks like, a little bit more dangerous looking, a little bit more threatening looking. That's on the nose. This is the hand. This is the lip. So, and a lot of times people, when this happens over time, it happens slowly. And that's the issue, where people just tend to ignore it. They keep thinking, oh, it's just a little thing. And then it gets bigger and bigger and bigger. And we don't see it getting bigger until it's to the point many times where it's like, whoa, somebody will come up to you and say, when did that come about? Because if we see ourselves every day, we just don't always notice the changes. So any sore that doesn't heal definitely needs to be looked at. And as Megan and I were discussing earlier today, there's many different kinds of skin types. There's the very light ivory skin. I'm not a celebrity person, but we have celebrity matches here. Emma Stone, Anne Hathaway, I believe that's Anne Hathaway, Kate Blanchett, they're all type 1. These people definitely are very prone to skin cancer and melanomas. Everybody should be wearing 30 plus SPF every day, just because this skin type is much more prone to having cancer. Then you have 2, and that's fair to light. They usually burn tans with difficulty. And then you have skin type 3, fair to beige, sometimes burns. So I'm not sure where you lie. I think I lie, let's see, rarely burn. I rarely burn, easily tan. So I think I'm going to be a 4. We have dark brown 5 and then deep brown 6. And you might think that these people here don't need to worry about skin cancer, but these are the people who get it in between their fingers. They are the people who get the acrolentigenous. And Bob Marley has died of that. There is an Illinois, let's see, her name was Catherine, one of our Illinois, what do you call her? Which not a princess, but whatever, I'll tell you later. So anyway, a lot of people have passed away from skin cancer that they just weren't aware of. So your skin type is a major factor in your risk of skin cancer, including melanoma. And determining your skin type can help predict your overall risk for sun damage and skin cancer. So people of color statistics, African Americans represent 1 to 2% of all skin cancers. Asians represent 2 to 4% of all skin cancers, and Hispanics represent 4 to 5%. People of color have higher percentages of acrolentigenous, which is what I spoke of earlier, than Caucasians. It's because they have less melanin in those areas between their fingers, on the bottom of their feet, and on the bottom of their hands. Whereas superficial spreading melanoma is the most frequent subtype in Caucasians and Hispanics. All right. So UV rays, there's UVA and there's UVB. UVA is actually what causes wrinkles in our skin. UVB is what causes the burning. So remember, A for age, you get wrinkles. B for burning, you get the sunburn. So UVA has a longer wavelength and is associated with aging because it goes deeper into the skin, as you can see in this UVA line. It causes tanning. It can cause sunburn. Let's see, the skin tries to prevent further damage by darkening, resulting in a tan. So it's going to prevent less sun rays from entering your skin. The main type of light used in most tanning beds. So tanning beds not only cause skin cancer, increased by 75%, but it also causes more wrinkles. So definitely avoid those tanning beds. It accounts for 95% of the UV radiation reaching the earth. And the rays maintain the same level of strength during the daylight hours throughout the year. And it also can penetrate windows and cloud cover. UVB, on the other hand, UVB is actually more the cause for skin cancer, but it is not around as long through the day as the ultraviolet A is. Overexposure of UVB causes suntan, sunburn, and in severe cases, blistering. The intensity fluctuates during the day. The highest risk is late morning to mid-afternoon. So you want to avoid the sun between the hours of 10 to 4. And I know that's probably when many of us are out. But if you're out and you want to enjoy that sun, try to get out early or later on in the day. And again, we do get vitamin D from the sun, so it's a very healthy thing. Just try not to get it from the very high points of the day and not that often. And FYI, in order to get enough vitamin D from the sun, you should be in the sun 20 minutes a day with your arms and legs showing. And I know in the winter, that's a very hard thing to do. So it is important to take your vitamin D supplements, especially in the Midwest where we live. So ultraviolet B can damage your skin year round. It's reflective surfaces like snow or ice. So the snow and ice in the winter actually increases the ultraviolet B that is penetrated into our skin. And it can be filtered and does not penetrate glass. So vitamin D does not, ultraviolet B does not penetrate glass. Ultraviolet A does penetrate glass. So when you're riding in a car, you definitely want to also have your sunscreen on for the ultraviolet A. Most skin cancers are caused by ultraviolet radiation exposure to the area of skin that develops the cancer. Indoor tanning devices, like we said, can emit ultraviolet radiation in amounts 10 to 15 times higher than the sun at its peak intensity. And what that does, it changes the genetic material, the DNA in our cells. And that's what causes the proliferation of cancer cells. In some families with inherited melanoma, so if you have a family member that has had melanoma, you are much more likely to develop melanoma also. So definitely keep a check on it. So here's the thing: tanning bed, nail beds, and the sun. All of these things cause carcinoma, melanoma, basal cell, squamous cell. And I just realized it's Miss Illinois who developed an acrolentigenous growth on her fingernail from using the gel nail polish and then having them put in the ultraviolet light during her high school years. So she is actually the person now who is going around trying to let young men who color their fingernails, let them know, do not use these ultraviolet beds to dry your nails because it will cause melanoma or skin cancer. Moles, melanoma risk factors. The more moles you have on your body, the higher your risk for melanoma. Also having large moles. So what did we say? If it's larger than the tip of a pencil eraser or any atypical moles, anything that you see growing, changing, we will talk about this a little bit more in another slide, but there are definite things to look for melanoma. And your family history. Like we said, that makes a difference. 1 in every 10 patients has a family member who has had the disease. So if you know somebody who has melanoma, definitely make sure that their children, their family members are aware that they have it so that they also become melanoma heroes and they know what to look for. So the risk factors for melanoma are your personal family history, immunosuppressed. So if you are undergoing cardiac transplant, kidney transplant, and you're on immunosuppressive medicines, you are much more likely to develop skin cancer. If your body is just in immunosuppressed age. So actually, skin cancer is very common in college age children or young adults, I should say. Many college adults, young adults, are not in the best of health because they're not sleeping as well. They're not eating at home, so they're not eating as well. They're also probably drinking more than they normally would. And all of those things depress your immune system or suppress your immune system. So the college age group definitely has a higher rate of skin cancer. And unfortunately, the men in that group, so the young adult men, have a higher death rate than the other age populations. And the reason for that is that they are the people who are most unlikely to go to see a physician. And I'm a true example of that. One of my sons had a very unusual spot on his arm. And I told him, he was at school, college. I told him he needed to check that out with his physician at school. Came home from school, didn't have it done. Next semester, sent him off, said, Joe, you need to have that checked. Came home from school, didn't have it done. So we were on vacation in Florida. I saw it again, and I took him to the physician by myself with him, said, you are coming. And they actually did a biopsy of it, found out it was not melanoma, but it could have led to it. And that's the reason why their death rate is higher, is because they just ignore the symptoms. Very important to act on the symptoms. Before the age of 50, the risk is higher for women. And after the age of 50, the risk is higher for men. So age is a factor for melanoma. Melanoma is less related to aging than most cancers, but it's still more likely to occur in older people. Melanoma is one of the most common cancers in people younger than 30. Melanoma that runs in families may occur at a younger age, such as in children. And sun damage is cumulative. Only about 23% of lifetime exposure occurs by age 18. So it occurs through a lifetime. And now we have basal and squamous cell carcinoma. This generally occurs at an older age because it occurs again from childhood to adulthood. The risk of basal and squamous cell skin cancers grows as people get older, and men are more likely than women to have basal and squamous cell cancers. And a lot of this could also be due to the fact that many more men work outside than women do. So again, there could be many reasons for this. All right. Now, basal and squamous cell carcinoma. Exposure to certain chemicals can increase this carcinoma. Large amounts of arsenic. So depending upon where you work, your job, the chemicals that are involved, where you work, where you live, it all makes a big difference. Industrial tar, coal, paraffin, and certain types of oil. Treatment with radiation, because radiation does increase the risk of skin cancer. So if you have cancer and you are having radiation to treat that cancer, you also have to be much more aware of that area in regards to skin cancers, because you are much more likely to develop skin cancer after treatment with radiation. And long-term or severe skin inflammation or injury can lead to basal and squamous cell carcinoma. So psoriasis treatment, certain rare inherited skin conditions called ectoderma pigmentosa and basal cell nevus syndrome. Smoking increases your risk of infection. HPV infection, so human papilloma virus infection, increases your risk of skin cancer. And you might find that unusual because HPV has nothing really to do with your skin. It's a virus that affects another part of your body, but it decreases your immune system. So it's going to increase your risk for skin cancer. And again, reduced immunity. So what can you do to prevent and beat skin cancer? Well, there's no sure way to prevent skin cancer because, as we all know, sometimes people do get skin cancers in areas where the sun never meets. But there are things everyone can do to help reduce the risk of both melanoma and non-melanoma skin cancers. Number one, limit the ultraviolet exposure. So remember the words slip, slap, slap, and wrap. Slip on a shirt and make sure it's an SPF approved shirt, a sun safe shirt. So the thicker the material, white does not prevent the sun from getting through, but black does. And the tighter the weave. And you can find a lot of sun-safe garments in a lot of your athletic stores, and many stores have them nowadays. So definitely our children should be wearing these sun-safe shirts and shorts when they're in the sun. Slop means slop on your sunscreen, and slap on a hat and wrap up with clothes. So don't use tanning beds or sun lamps. Protect your skin with clothing. Be aware that covering up doesn't block out all UV rays. Some sun protective clothes have a label listing the ultraviolet protection factor value. So clothing, umbrellas, stay in the shade. Sunglasses are very important. They should be ultraviolet protective, not just pretty, but they definitely should be ultraviolet protective because the sun also affects your eyes. It's called photokeratitis, and that will affect your cornea and cause you to develop eye issues also. Wear a hat. Your hat should be wide brimmed. And if you have a back to your hat, a lot of the fisherman hats have the back, or some of them also have something that has the visor in the front, and then it protects all around the neck. So if you are a very avid fisherman, you definitely should wear one of those. So your sunscreen should be broad spectrum, sun protective factor, SPF. Put it on about 20 to 30 minutes before you go outside and reapply at least every 2 hours. Do not use sunscreen to stay out in the sun longer. Again, wear your sunglasses, stay in the shade. The worst sun hours again are between 10 to 4 p.m. And just a little tip, if your shadow is shorter than you, so if you're in the sun and your shadow is smaller than you, the sun rays are the strongest. So stay inside or be extra careful and slap on that sunscreen. Protect your children from the sun because they are in the sun from childbirth until future. So make sure they have their sun-safe clothes. Warn them not to use tanning beds, tanning lamps, or sun lamps. And vitamin D, very, very, very important. It's important to build bone. It's made naturally by your skin when you are in the sun. And it's best to protect your skin from the sun and get vitamin D by mouth. So what are some good ways to get vitamin D? 3 ounces of salmon provides 447 international units. 1 glass of 8-ounce vitamin D fortified orange juice, or 1 glass of 8-ounce vitamin D fortified milk. Now, FYI, most of our milk is fortified with vitamin D, but whole milk, because it has a greater fat content, transports the vitamin D to a greater extent than the skim milk would. So whole milk is not that it has more vitamin D, but it helps your body absorb it better. Finding skin cancer early. So get your skin checked by a healthcare professional once a year. And your doctor should be willing to discuss the concerns you might have about this exam. And how to perform a self-exam. You should examine your face, especially around your nose, lips, mouth, and ears, front and back. You get a mirror and look all over. Look behind your ears, in your ears, and if you can't see everything, have someone else inspect for you. Inspect your scalp. If there's any itchy areas in your scalp, when you go to your physician, they actually will pull your hair in different directions so they can see in different areas of your scalp. And in case you do happen to go to the free skin cancer screening on September 25th, if there are any areas that you have of concern or you have questions about, point them out. Don't expect them to find anything. It's always helpful if you are your best advocate. So they will look as much as they can, but you are your best advocate always in every health situation. And let them know if you have something unusual or if something has changed. Check your hands. Again, you want to check in between your fingers, the palms of your hands, and the tops of your hands. Scan your arms all around. I actually have one. I don't know if you can see it on the picture, but this is one of my many I don't know if you can see it, but one of my many black spots that my last physician checkup said, you need to keep an eye on this and let me know if it changes. Call me immediately if it changes. So I've been keeping my eye on it, and we'll see what happens. Inspect your torso. And again, checking your back is very difficult. So have someone else check your back for you. And scan your lower back also, and your legs. Very, very important. Ankles, feet, and between your toes. A, B, C, D, E of melanoma. So A, B, C, D, E. A stands for asymmetry. If half the mole does not match the other half, it's asymmetrical. So if you take your mole and put it over this way, if it's not symmetrical, that's a clue. If the border is jagged, so if it's not a circle, that's another clue. If the color is not the same, so if you have some brown, some black, that's another clue. If the diameter is greater than 6 millimeters, which is the size of the tip of the pencil eraser, that's another clue. And if it's evolving, so if it changes, that's another clue. So A, B, C, D, E, asymmetry, border, color, diameter, and evolving. And here are some good examples. So these are all benign, which means they are normal, okay? These are malignant. These are cancerous. So this is normal. If you flip this over like a pancake, it's pretty much symmetrical. This definitely is not symmetrical. The borders of this are very jagged. There are definitely 2 or more colors here. The diameter here is larger than the pencil. And I don't know if you can see that, but this is definitely changing. So you have like a piggyback on one another. So that is also another sign. Melanoma carcinoma is best found early. So normal moles are evenly colored brown, tan, or black spot. They can be either flat or raised. They can be round or oval, generally less than 1/4 inch across. So these are just a bunch of normal moles. And many of us have many of these. Some people have none, but many of us have many. The more you have, the more prone you are to having skin cancer. So the more you have, just make sure you keep an eye on it. Once a mole has developed, it will usually stay the same size or shape and color for many years, but over time, they may fade away in older people. Most people have moles, and almost all moles are harmless. It's important to recognize any changes, because if it changes, you want to see your physician immediately. Call them up and get into them to do a biopsy or just to check it. So know your skin. Check your own skin, preferably on a regular basis. You should be checking your skin once a month in a well-lit room. Examine all areas. And you should be checking in with your doctor once a year. Key warning signs are a new growth, a spot, bump, or mole that has slowly gotten larger over a few months or 1 to 2 years, a spot or mole that's changing in shape, feel, or color, or a sore that doesn't heal within 3 months. Be sure to show your doctor any area of your skin that concerns you. And here is the reason we are here today. So here is Meg Donovan Moonen, whose kindness and strength touched many people. She was the mother of 4 and developed skin cancer as a young mom. And that is why we are here today, because of the March for Meg Foundation, so that more people are aware of how dangerous skin cancer is and how to prevent it. So just FYI, if any of you are active and like to exercise, like to run, like to walk, we do have a March for Meg run, and that always happens in Evergreen Park in March. So if you have any interest in doing that, you can go on the March for Meg website, and they will tell you all the information, and you can like them on Facebook or do however you want to do something like that. It's fine. And I am going to stop this share right now and show you something else, because you all possibly may have heard about new recommendations from the FDA in regards to sunscreen and what sunscreen does to our skin, our health, and coral reefs. So because we are using sunscreen more often now, we are fine, and there's all different kinds of sunscreen out there. The FDA is looking more closely into it and has recommendations. So they are coming out with new recommendations no later than September 27th this year. So keep your eye out for it, just so you know what they have come up with. But as of now, they are saying the sunscreen that you are buying or you are using should be natural products, and it should be mineral sunscreen containing zinc oxide or titanium dioxide, because these provide a physical barrier and help reflect the sun's rays. So 2 chemical sunscreen ingredients to avoid are paraminobenzoic acid, or PABA. So write those down. Let's make sure they're not in your sunscreen. And trolamine salicylate, because the risks outweigh their benefits. Both have largely disappeared from sunscreens, but some of them may still have it. So just check yours. And they're evaluating 12 chemical sunscreen ingredients that are probably in many of the sunscreens right now. These are sinoxate, dioxybenzone, and sulazole. I don't know if any of you are chemists out there, but these are all very difficult words to pronounce. Homosalate, miratamate, actinoxate, octisalate. I'm going to let you read these. So, but this one, oxybenzone and avobenzone. So oxybenzone, sorry, where am I going here? Oxybenzone is the most concerning. Studies have shown it's absorbed through the skin in large amounts and has been found in breast milk, amniotic fluid, urine, and blood, and is a potential endocrine system disruptor. So definitely, from what we know right now, do not have this in your sunscreen. Besides oxybenzone, studies have found that actinoxate, also called octyl methosinamate, homosalate, octisalate, octocrylene, and avobenzene are absorbed into the bloodstream. So it's not as disruptive as oxybenzone, but actinoxate is still something to be concerned about. And just so you know, Hawaii has banned oxybenzone and actinoxate because they are toxic to coral and other marine life. So it goes to show you it's killing our coral and marine life. So just think of what it's doing to your child if you put this on your child every day. So these are definitely, again, I'm going to go over these. Oxybenzone and actinoxate are ones you should definitely be avoiding at this time. And I'm going to go back to this one so you know the right thing to use. Zinc oxide and titanium dioxide are the best because they cause a barrier. Now, unfortunately, they do provide a little bit more white on your skin. So if you're white already, you're going to be whiter. But they are the safest ones that we know to date. And again, they're doing, as everything in medicine, and I've been in medicine a long time, things change from day to day. And the only way we we know is from doing research. And then sometimes we have to come back and say, you know what, we thought what we were doing was right. And through research, we have found that we should be doing something different. So right now we know that oxybenzone and octinoxate are not things you should be putting on your skin. They are also looking into the factor of what your SPF should be. So we are recommending 30 or greater for your SPF. That's your skin protective factor. And SPF of 30 as opposed to SPF of 50 or 60. FPS of 50 and 60 provides like 97 to 98%. So anything higher than that really doesn't do much greater help for you. So they're going to be looking into what really should be the highest of SPF out there. So just so you know. They're also looking into sunscreen sprays. And I know I've been around people who use sunscreen sprays, and I can actually smell it, feel it going down into my lungs. And unfortunately, I see a lot of young parents using this on their children. So if you can imagine spraying this on your children and it gets into the air, and that's the air that the children are breathing, it's definitely getting into their lungs. So we don't know because we don't have any research on it. We haven't seen it. It hasn't been out long enough to do research on it. But I would be hesitant to use sunscreen spray on me or my children, especially. So we're going to go back to here's a question. Now you can either come off of mute or you can put it in the chat. Select the correct answer. Tanning beds can cause cataracts, premature aging, melanoma, A and B, or A, B, and C. Who's brave enough to answer that? Nobody. Well, it's A, B, and C. So tanning beds can cause cataracts, premature aging, and melanoma. So there you go. Any questions from tonight?
Sue, if there
we're good.
Yeah, I have a question.
Yeah.
Things like I was speaking with Sue, guys, before everybody got together because I'm very fair and I have history of skin cancer in my family. So I'm very concerned and passionate about this topic. But so in terms of the SPF, like anything above 50 or so doesn't provide much more coverage. Is that right, Sue?
That is correct.
Okay. Like it might be like a tiny bit, but it's kind of negligible. They're kind of
right. And they're just wondering if it's really worth it. The benefit worth right. The risk versus the benefit.
Got it.
So that's what they're going to be studying with this, looking at the limiting sun protection factor.
Okay. Okay. That's good for me to know. Cause I get like, if I know I'm in the sun, I put on like SPF 70 on my arms and legs. Cause I just,
right.
Right.
Know? And do you find that the ones with SPF factor do they provide much more protection, or have you noticed anything?
I think they do. Like
you see a difference. Okay.
Yeah. If I have SPF 30 and I'm out in the sun for a few hours, I get a little red, if I don't reapply, right?
Mm-hmm.
But if I was just out over the weekend in the sun for like 5 hours, had SPF 70 on my arms and legs, nothing. No redness, no.
So that actually is, so SPF is not how much it protects you from the sun, but how long it protects you from the sun. So SPF 15 protects you 15 times more.
Okay.
SPF 30 protects you the length of 30 times more,
Oh, interesting.
if that makes sense.
Yeah.
Yes,
Okay,
it's
that's
the
good.
length of time that it protects you that you're wearing it.
Okay. Okay. That's good. Well,
So what you would have to do if you have an SPF that is a lesser amount, you would have to apply it more frequently.
gotcha. Okay.
Yeah,
That's good.
as you should do also if you're swimming, or, if you're swimming, you should apply it every 1 to 2 hours.
Or like if you're sweating.
Even if it's water resistant, water protective, because it still tends to come off.
Okay. Okay. Very good.
Okay, any other questions?
Doesn't sound like it.
All right, well, thank you for coming on tonight, and hope to see you or anybody else you would like to invite to our skin cancer screening September 25th at the Oaklawn Library from 9 till 12:30. And if you would like to make an appointment, just email me, Susan, SUSAN LATOCHA @AAH.org.
Great. Thank you so much for being with us tonight.
Thank you, and stay safe in the sun.
All right. Good night,
All
everyone.
right, bye-bye.
Bye.